Hello, everyone. My name is Antonio Moya. I am a neurologist in Los Angeles and executive chair for the Council of Young Filipino Americans in Medicine. Thank you, everybody, for joining this weekend to talk about COVID-19 vaccines para sa ating mga pamilya. We have our speakers here, and I'll be introducing all of them to you. Just some housekeeping rules. We want to inform you that this session will be recorded, so please place your mic on mute throughout the session until the end of the presentation, at which time we will be taking questions and answers. And just as a disclaimer, if you have any medical questions specific to yourself or a loved one, please know that this webinar is not a substitution for individualized medical advice, and please be sure to contact your primary medical provider. So with that, I have the pleasure of introducing our esteemed speakers for this presentation. And our first is Dr. Melissa Palma, pronouns she and her. She is a family medicine and preventive medicine resident at Cook County Health in Chicago, Illinois. She is an active mentor for the Research and Education Committees of the Council of Young Filipino Americans Physicians in Medicine. She also serves as a medical and public health advisor for tayohelp.com, a program of the Filipino Young Leaders Program to provide trustworthy, culturally tailored information for Filipinos in the US. We will also be having Sheena Garcia, who's a proud Filipino-Canadian researcher who received her Bachelor's of Science in Biochemistry at the University of Toronto, currently a fourth-year PhD candidate in both biophysics and molecular oncology training programs at New York University. She's one of the founding members of Filipinos in Canada Academics, Research and Scholars, or FICARS, and like Xian, is one of the research committee co-chairs of CFAM. She also wants to say that she misses her mom's lumpiang sariwa and can't wait to visit her family back in Toronto soon. We have Xian Benson, who is a MD PhD student at NYU School of Medicine, currently getting her PhD in immunology and microbiology. She is a California Bay Area native and currently serves as co-head of the research committee for CFAM. At the end of this webinar, we will have our guests also on the panel. We have Samantha Sumait, who is a first-generation Filipino-American from Chicago, who's passionate about diversity in higher education and the impact of information technology and social media on healthcare. Samantha is currently a neonatal intensive care registered nurse and is also a doctoral family nurse practitioner student at Rush University. We also have Dr. Jocelyn Supan, who is a pediatrician. She finished her residency training at LAC USC and is currently a general pediatrician at CHLA. Her career has been dedicated to caring for the underserved and vulnerable communities of LA County. And last but not least, we have Dr. Homer Abiad, who is a graduate of the University of the Philippines College of Medicine and trained in infectious diseases at the University of Chicago and the University of Illinois at Chicago. He is an infectious disease specialist at Stroger Hospital and an assistant professor at Rush Medical College in Chicago. So with that, we'll be starting our webinar. I'll give it over to Dr. Melissa Palma.
All right, well, thank you everyone for having us all here. We're excited to share a lot of this information with all of you. And if we could please have our slides brought up. All right, so today we're here to talk about COVID-19 vaccines para sa ating mga pamilya. And we wanted to start out this conversation with a story. So if we can go to the next slide, I just want to tell you a story about a family that I think we all know very well. So I want you to meet the Gonzaga family. The mom, Marites, she's a Filipino-American ICU nurse. And during the peak of the COVID hospitalizations in her community, she feared bringing home the virus to her family. So much so that she isolated in a hotel room for 2 months before her shifts at the hospital. Marites lives with her 2 school-age children, Bea and Paulo, who have been virtual learning the entire school year. As parents, they're they're nervous because they have children under the age of 12 and who are too young to be vaccinated, with in-person schooling beginning again this fall. Maritas's husband, Josh, he's a middle school teacher who has struggled to care for both his children, as well as Lolo and Lola, who all live together in one home. And we just wanted to center this talk around family because we all know that as Filipinos, this is a very important people in our lives. And coming on to the next slide, I just wanted to introduce some goals for today's session. We really do want to introduce the science of vaccines, review current public health guidelines about COVID-19, Delta variant, and other variants of concern, as well as discuss trusted community resources and public health guides to learn about the vaccines and promote discussion of local outreach for vulnerable populations. And then with that, I'm going to turn it over for facts about science behind the vaccines to our next speaker. Thank you.
Thank you, Dr. Pama. Hi, everyone. Again, I'm Shen. And in this first part, we'll be talking about the science behind the COVID-19 vaccines. Next slide, please. So how exactly do vaccines in general help to keep us healthy? Well, disease-causing organisms like bacteria and viruses are called pathogens. And our body has many physical barriers like our skin and mucus that help to keep these pathogens from getting into our bodies in the first place. But many pathogens are very skilled and they've evolved ways to evade these physical barriers and infect us. And in those cases of infection, our body has very sophisticated mechanisms, specifically our immune cells, that have evolved ways to detect these pathogens and destroy and clear them before they can cause even more disease or even death. Next slide, please. And one of those major defenses that our immune cells have against pathogens are antibodies. So antibodies are soluble factors. They're very specific to each pathogen, and they can do two things. One, they can mark the pathogen so that it can be cleared by other immune cells. And two, most importantly, in the case of COVID-19, antibodies to SARS-2 can bind the outer surface of the SARS-2 virus, specifically its spike proteins, and keep the virus from binding our own cells and infecting them. And so as you can see by the cartoon on this slide, many of us have existing antibodies that are circulating in our blood, many due to previous vaccinations, so against flu, measles, or chickenpox. But when a new virus or pathogen comes around, like SARS-2, our body needs to make new antibodies that recognize this new pathogen. And in the case of natural infection with COVID-19, the production of these antibodies can take up to 2 weeks or even more. And in the meantime, that can make us very, very sick or even hospitalized. Next slide. And so this is where the vaccines really come to the rescue. The vaccines contain part of the pathogen, but not the whole pathogen. And so this enables us to not get sick, but also mount a very strong immune response and produce these antibodies that we need to protect us. And so listed here are some of the vaccines that have been emergency authorized in the US and in the Philippines, and even those that are in late stage clinical trials and nearing authorization. And the major goal of all these vaccines is to get our bodies to produce these antibodies to the COVID-19 spike protein. They do this a few different ways. So some vaccines provide the spike protein itself so that we can make antibodies. But other vaccines like the Johnson & Johnson and the Moderna and Pfizer vaccines provide the genetic blueprints our body needs to make the spike proteins itself. And so these can come in the form of DNA blueprints, as in the Johnson & Johnson vaccine, and mRNA blueprints, as in the case of the Pfizer and Moderna vaccines. Next slide. And so just a little bit about how these mRNA vaccines work, since these were the first emergency authorized and what the majority of the US population has taken. So just in a little detail, the vaccine containing RNA is injected into a person's arm. And as I mentioned, this RNA provides the instructions our body needs to make the coronavirus spike protein. And just like us trying to follow Lola's recipe for how to make her famous palabok, our body cells, including the muscle cells in the area of the injection site, read these instructions and make the coronavirus spike protein. And so the second step includes our immune cells. Our immune cells are surveying our body's tissues and our blood, and they come across these new spike proteins that were just made. Using things like antibodies, they're able to recognize the spike protein and actually fight over it. In the end, the immune cells that have the antibodies that bind the spike protein more tightly win out, and these are the antibodies our bodies produce more of and have at the ready. In the case, if we are infected with the coronavirus itself, it can recognize it and protect us. Next slide. And now I'll pass it off to Sheena.
Thanks, Shen, for that amazing explanation of the mechanism of the mRNA vaccines. So piggybacking off of this idea of mRNA being used in a vaccine, some of the common concerns that arise include, can I get COVID from mRNA vaccines? Our answer to that is, absolutely not. As Shen explained, the mRNA in these vaccines gives instructions to cells on how to make a harmless piece of the virus, namely the spike protein, which exists on the surface of the virus. Once the instructions of the mRNA are inside your cells, the cells will then make the spike protein, and your immune cells will recognize that spike shouldn't be there, which is how you develop immunity. So the thing I really want to emphasize is that mRNA vaccines give instructions to make only the spike part, but not the whole virus. On this slide, I really wanted to use the longsilog analogy. So let's think of the SARS-CoV-2 virus as longsilog. As you know, in order to make longsilog, you need 3 important ingredients: longganisa, sinanag, and itlog. With mRNA vaccines, we're only teaching our body to make one little piece. I suppose in the case of longsilog, it's like we're only making itlog, but one itlog is not enough to make longsilog. You're missing so many other parts. And so conversely, the mRNA vaccine is only giving instructions for the spike protein, but not for all of the other parts of the virus. Therefore, it's impossible to get COVID-19 from the vaccines themselves. Next slide. So moving on, I wanted to address the novel COVID-19 variants that are coming out and what their impacts on vaccine efficacy could be. I know a lot of the terminology may seem really intimidating. Words like variants and mutations sound like something right out of a science fiction novel. But what does it mean to be a variant, and what is a mutation? So as the coronavirus spreads throughout the world, genetic variants of the virus have begun to pop up. Genetic mutations occur during the process of viral replication. As the virus replicates itself within your body, sometimes it makes mistakes. Now, a vast majority of the time, these mistakes actually don't have an effect, or they're actually really bad for the virus, so they tend to die out. However, sometimes the mistakes actually help them out. In the case of the variants, they carry mutations that help them spread faster. If a variant spreads faster than other versions, then it outcompetes these older versions and becomes the predominant strain. This effect can actually be seen on this bar graph, where over time, the Delta variant became the predominant strain in the US. So you can see that like in the first column, back in April, the Alpha variant used to be the predominant strain, but over time, the darker orange representing the Delta variant started to be encompass a majority of the cases. So next slide. In this next slide, I just wanted to provide a reference between the Greek nomenclature and the country or state of origin, because the strains themselves aren't new despite these new names that we're giving them. For example, like the Alpha variant was what was once called the UK variant, and the Delta variant, which is what everyone's worried about now, is the one that was originally identified in India. These variants of concern spread faster than the original strain, but it's important to note that our current vaccines still offer protection against all of the variants, including the Delta strain. So to explain why we know that vaccines are still effective against the variants, I first wanted to introduce the mechanism of the spike protein. So the spike protein exists on the surface of SARS-CoV-2, the virus that causes COVID-19. And when it's in your body, the spike protein binds to the ACE2 receptor on the surface of our cells, allowing the virus to then enter our cells. To simplify the mechanism between the spike protein and ACE2, I would like for you to think of the spike protein as a key and the ACE2 receptor as the lock of the door into the cell. Next slide. So when you've been infected with COVID-19, the spike protein latches onto the ACE2 receptor in much the same way as you inserting a key into a lock and turning it. Next 2 slides. I apologize, this is supposed to be like a weird animation. So you can see here, I tried to show that ACE2 receptor is like the lock. You twist the lock, 1 day to bind, and then the virus enters the cell, which is like not great. Thanks, Nico. So, and it's really through this interaction that the virus is able to open the door, enter the cell, and hijack the cell machinery to then replicate. Next slide. Scientifically, we say that these mutations slightly change the shape of the protein, which confers increased binding affinity to the spike protein to the ACE2 receptor. And if we think of the spike protein as a key, the COVID-19 variants carry mutations that cause the teeth of the key to change shape and allow it to better fit the lock in the door. Next slide. On this slide is a very comprehensive look at exactly what those amino acid changes are. Generally, mutations are just 1 to 4 amino acids different from the original strain. And in the next slide, I created diagrams using the atomic structures of the spike protein. So in red are the exact changes in these mutations compared to the original version of the spike protein. What I hope you can appreciate from this slide, from this side-by-side comparison, is that the mutations don't drastically change the shape of the protein at all. In fact, a vast majority of the protein remains the same. So despite the mutations, a majority of the epitopes remain the same between the original strain and the new variants. So if our antibodies work by recognizing specific shapes of viral proteins, while there might be a slight drop in vaccine efficacy, because the overall shape of the spike protein is retained, our immune system can still learn from the current COVID-19 vaccines and protect us in case we come in contact with the virus. Next slide.
Great, thanks, Sheena, for the deep dive into COVID variants. Now I'll take a few slides to focus on the variant of most concern at the current moment, which is the Delta variant. So maybe many of you have seen the headlines from the past week, and one of the most notable was that the CDC warned that the war has changed. And in total, this really just means that the vaccines are even more vital at this time. And this comes in response to new data that was uncovered that the Delta variant is more contagious than previous variants that we've seen, and even proclaimed in headlines, as you can see at the bottom right, to be as contagious as chickenpox. But really, what does that mean? Next slide. So my goal for this slide and the slides to follow is to talk about Delta, how it's different from previous variants, and also how it affects unvaccinated people as well as vaccinated. And so to start off, to focus on transmission, as you can see here, the Alpha variant was thought to be 2 times as transmissible as the original Wuhan strain of COVID. So it's estimated that for every unvaccinated person that was infected, they would infect 3 vaccinated individuals. At the time of the Alpha variant, around February, there was great promise in the vaccines that were just beginning to roll out, because it was found that vaccinated individuals very rarely spread COVID to other people, as well as they had very low levels or viral load, meaning the amount of viral particles they carried in their nose and throat. And so we're less likely to spread the virus, even if they did become infected through coughing or even just talking. And so these data was actually what prompted the CDC to reverse the mask mandates and recommendations for those who are vaccinated. Next slide. But as you know, many of this has changed just in the past couple weeks. And the bottom line here is that Delta spreads as fast or even faster as juicy chismis in your WhatsApp. So in comparison to the Alpha variant, the Delta variant is thought and estimated to spread in an unvaccinated individual to 7 to 8 people. And just to put that into perspective, the contagiousness of chickenpox is 1 person to 7 people. And what was really scary with the new data that was coming out, and especially data from individuals in a cluster of infections that occurred over July 4th weekend, where vaccinated individuals were unmasked in indoor spaces, and actually a lot of them tested positive. It was found that these individuals that were vaccinated but positive for COVID carried as much virus in their nose and throat as unvaccinated individuals, meaning that they're as likely to transmit the virus to other people as someone who was unvaccinated. And so this data is what prompted the return of the recommendations for vaccinated individuals to continue to wear masks indoors. But what's one thing to keep in mind is that it's viral replication in the lower airways and also lungs that lead to symptomatic disease. And so even those infected on the July 4th weekend, they showed very mild or no symptoms. In all this, Delta being more transmissible just means that those who are unvaccinated are even greater risk of encountering COVID from those who are vaccinated or unvaccinated at this moment. Next slide. So you might be wondering, well, if transmission is equal between unvaccinated and vaccinated, what does this mean for me if I'm vaccinated? How protected am I against Delta? Next slide. So to put this into perspective, just to reiterate and focus on asymptomatic disease or testing positive but not showing symptoms, we see that there is slightly less protection against the Delta variant. So when the vaccines rolled out, it was thought that vaccinated individuals were 95% less likely to contract mild disease compared to those who are unvaccinated. This is in contrast with those who are contracted with the Delta variant currently and are thought to have 80 to 90% protection against mild disease or asymptomatic disease. Next slide. And so this might make you think that, well, if I'm vaccinated, this means I'm more likely to get COVID. And many news stories and headlines have tried to build off of that scare. And so as you can see here, a recent tweet said that at least 125,000 Americans who are vaccinated have tested positive, right? And these are what we call breakthrough cases, positive cases in people who are vaccinated. Next slide. But what these headlines are not focusing on are the millions of people that are vaccinated but have not tested positive. So shown here on the right is data from the CDC, and of the different ages that are approved, over 5 million Americans in total have been vaccinated against COVID. And so what does that mean? It means that although 125,000 Americans have tested positive, there are 99.93% of people who are vaccinated in America that have not. Next slide. And to put this into real world numbers, that means that less than 1% of all vaccinated have had symptoms or mild disease. And so these breakthrough infections still are rare from the data that we have so far. Next slide. This is similar data for hospitalization, so even more severe COVID. And the bottom line here is that vaccines remain effective, especially against preventing hospitalization. So as you can see, although protection is slightly lower against the Delta variant, next slide, less than 0.001% or 0.004% of all vaccinated individuals have been hospitalized. So hospitalization is rare, next slide. And deaths are even rarer, so even less than that, 0.001% of all vaccinated. So the bottom line here is that the vaccines can still hold up well, just like this Olympic weightlifter and the Olympic weights. The vaccines hold up well against the Delta variant and especially against symptomatic disease. Next slide. And so it's important to get vaccinated, as you just saw in those slides, on an individual basis. But what I'm showing you here is data from the CDC supporting the need to get vaccinated because of data that's been shown nationwide. So the bottom line is that cases are rising, and they're mostly rising in areas where vaccination rates are low. Each of the regions on this map are colored for two different metrics. One based on the number of cases. And so these areas with higher cases will have a greater contribution of this Jollibee red color. And what they're also showing here in the colors is the percentage of the population that's vaccinated. So areas with higher rates of vaccination will be more of this green color. So for example, New York City, where I study, is more of a greenish blue color, and this is because of the high rates of vaccination in the city and also the low cases. Next slide. This is in contrast to areas in Southern California, which are colored more purple pink, suggesting that vaccination rates are very low in these areas and cases of COVID are high and even rising. And so what this really highlights are these hot spots of red Jollibee colored areas that we need to focus on. And these are the areas that vaccination rates need to increase in order for us to stop the spread of the virus, but also to keep this virus from having more pressure to mutate into other variants. Next slide. And of these cases of unvaccinated individuals, the most concerning are actually in the young adults. So shown here is just a bar graph where in red, the percentage of total COVID cases are shown for each age group. And this is juxtaposed against the gray bars showing the percentage of those age groups in the US population. And what's really important is to focus on the age groups where the red bars surpass the gray bars. This means that the cases of COVID for that age group are overrepresented based on their representation in the US population. So as you can see, this disparity between the red and the gray bars is most striking for the 16 to 17 age group. This might be due to a number of different factors, one of them being that the vaccines were authorized for this group a little bit later than the older groups. But it's also been anecdotally noted that these groups think that they have less of a chance of getting severe COVID and are maybe putting off vaccinations. And a story by the New York Times in the past week has highlighted many ER physicians noting that many young adults are being seen in their hospitals, and they're not only sicker than they were this time last year, but also more quickly deteriorating. So what this really highlights the need to combat this Delta variant because it seems to be more virulent across all age groups and non-discriminatory. This is also why us at FilAm are embarking on this social media campaign to reach these younger individuals and try to encourage them to get vaccinated. Next slide.
Thanks, Shen, for that. So now I know there's been a lot of news lately about the recent changes in the CDC guidelines and the updated mask recommendations. If you have not heard, these changes are due to an outbreak of COVID in a small town in Massachusetts. So according to the CDC report, in July 2021, 469 COVID cases were associated with summer gatherings in Provincetown, Massachusetts. This was surprising, considering that 69% of the town had already been fully vaccinated. What was quite notable was that about 3/4 of the COVID cases were in fully vaccinated people, and the Delta variant also accounted for 90% of the cases. And within the fully vaccinated people who caught COVID, 79% were symptomatic, 4 were hospitalized, and fortunately there were no deaths. Next slide. So what does this mean? Does it mean that the vaccines don't work? Absolutely not. It's important to recognize that vaccines, much like masks, social distancing, or washing your hands, is not a cure to the coronavirus, but another very essential measure against the virus itself. Vaccines boost our immunity against COVID, but they don't make us invincible. An analogy I've seen lately that I've really liked is a comparison between vaccines and seatbelts. Next slide. So when you're in a car, it's important to wear your seatbelt, but if, God forbid, you get into a car accident, there's still a chance that you can get hurt, regardless of whether or not you've had your seatbelt on. Does this mean that seatbelts don't work? Should we all just stop wearing seatbelts? No, of course not. They are still an important safety measure and have been shown that, if you do get into an accident, you're far less likely to be severely injured versus passengers not wearing seatbelts. Next slide. Sorry, next slide again. And just like that, vaccines do the exact same thing. If you get vaccinated, it doesn't 100% prevent you from catching COVID, but if you do get sick, you're far less likely to get a severe illness versus those who are unvaccinated. Vaccines work. Next slide. Also, because it is still possible to catch COVID, despite being vaccinated, it's really important that all of us continue to wear a mask in high-risk areas and take the proper safety precautions. Next slide. With that being said, like, I totally get it. All of these new changes can be super confusing. I've heard from a lot of my friends who aren't in the field that, this inconsistent messaging from political and scientific leadership and all these frequent changes have cast a lot of doubt in the integrity and legitimacy of the scientific method. That's what propagated this myth of, is the science really all in if we keep making all of these changes? Next slide. But with that being said, it's important to note that it's normal for CDC guidelines to accommodate to the current situation in our country. Like in this case, after seeing that there are a lot of new cases now, despite a majority of the population being vaccinated. That's why now we're switching back to masks. So next slide. And one feedback I got from my friend was, I wish that the scientific community would just tell us what they don't know and just make everything more crystal clear. And so the next couple of slides, I put everything out on a table just to make it super straightforward for everyone. So what do we know? We know that COVID vaccines are safe and effective at preventing COVID-19 disease, and especially severe illness and death. Vaccines reduce the risk of people spreading the virus. Vaccines are effective at protecting you against the variants, and it is normal for you to have side effects after vaccination. Next slide. And I'll be quite frank, this is a list of what we're still learning. How long will these vaccines protect people, and will we need a booster shot? How many people need to be vaccinated against COVID-19 before the population can be considered protected? To what degree of effectiveness do our current vaccines have against the new variants? And finally, how well do these vaccines protect people with weakened immune systems? Next slide. This is all stuff that is currently ongoing. And, you have people like myself and Shen working all around the world to get these answers for you, because we all really want to, protect ourselves and finally put an end to this pandemic. So with that, I'd like to pass it off to Dr. Palma again to talk about COVID misinformation and vaccine resources.
All right, thank you, Sheen and Shen, for that wonderful information about the science behind vaccines and Delta variants and what we do and don't know at this point in time in the pandemic. And I just want to direct our attention to some different resources that we have here in the FilAm community that can help us who might be able to attend these talks and learn about the vaccines and how we really translate this to our families, our titas, our lolos and lolas, who may have be looking for other direct answers from a trusted loved one. So next slide. If we just look at, this whole, discussion that we've had today, there really are a lot of really amazing reasons why we should all get vaccinated against COVID-19. They're backed by science, have few serious side effects, protect our families, and have over 4.4 billion doses administered over the world. Also backed by the Philippine Conference of Catholic Bishops approved. And all of these things are able to help us try to prevent these severe COVID-19 diseases, severe death, and continued lockdowns throughout. But on the next slide, I want to show kind of like a bit of a danger of things that can happen when we're all trying to get all this new information all the time. And one of these is figuring out where are our trusted resources and where do we have disinformation. So the Philippines and many other groups have one of the highest rates of social media uses in the world. And this can be a common source of disinformation. In your family's Viber chats, in your family's WhatsApp chats, your Facebook messaging chats, I'm sure you've seen lots of different memes claiming certain miracle cures from COVID or different side effects from COVID that may or may not go with the science. And we always want to show that, for our family members, what everyone is going through right now is very scary, and emotions can put people at risk for making decisions that are based on perception and intention rather than actual science and rational thought. And so always, when you're approaching your family members who might be, getting different theories off of the internet, to really show that, understand their concerns, find out why they're afraid and what questions they have, and try to go beyond just presenting the factual information and address their emotions regarding COVID-19. And then on the next slide, we just want to show that there are many different ways that you can find trusted resources, one of which is through the Centers for Disease Control here in the United States, but also the Department of the Philippines Department of Health actually has its own Vida Solucion COVID-19 vaccination. And so while there are many different types of campaigns online that are claiming to be coming from local departments of public health, barangay health units, it's actually only the Vida Solucion branded COVID-19 vaccination that's actually been approved by the Department of Health in the Philippines. Additionally, your state and local health departments and your local community health center are really good places to find culturally tailored factual information about COVID-19. I also want to share a few other community resources in the Filipino American community on the next slide. One of them, which AFIRE Chicago, Alliance for Filipino Immigrant Rights and Empowerment, has information on how to contact the Cook County Department of Public Health on how to have at-home COVID-19 vaccinations for home health workers and other vulnerable frontline health workers. The Kalusugan Coalition in New York and New Jersey has put together a COVID-19 Tagalog language resource kit, as well as the Mabuhay Health Center in San Francisco has many different Filipino language, vaccination, COVID-19 information and vital resources available in Tagalog and English on their website. Again, moving on to the next slide, Filipinos aren't just in the two coasts, they're everywhere in between. Another group to think about is our own group with the Filipino Young Leaders Program and tayohelp.com, as well as a really great group based out of Texas, the Texas Philippines for Public Health Resources that have a lot of really great Instagram videos and infographics about how to keep safe. This one particularly about how to wear a double mask to protect yourself against COVID-19 variants. And lastly, but not least, the Philippines AO Community Health Association also has a podcast series in which they call upon health experts like Dr. Inez Ponce and Dr. Carlos Oronce from UCLA and other places all across the United States to talk about their podcast or Philippines sharing stories together. So I encourage you to reach out and look at all of these different resources when you're trying to educate yourself as well and your family members about COVID-19 vaccines. And on the next slide, one of the other partners for this webinar is the We Can Do This campaign through the Department of Health and Human Resources, particularly vaccines.gov. And if you look on the next slide, it shows you a really great tool to help you sign up for COVID-19 vaccines. So for example, if you just search vaccines.gov, if you text your zip code to 438829, or if you call the number 232-0233, those are all ways that you can find, search by your zip code, find a provider in your area, as well as book an appointment. So for example, I put in my address and they sent me a text message. Within 30 seconds, I was able to get a response from this resource through We Can Do This and vaccines.gov. They also offer the availability for childcare if you're unable, or as well as transportation. So you don't have to call the tito who has a family jeeply. You can actually get transportation to your vaccine appointment. And on the next slide, it's just an example of the website. So for where I live in Chicago, Illinois, within 5 miles of zip code 60630, or the location of the Jollibee in Chicago, Illinois, more than 50 vaccine providers are there to be able to help you protect your family and protect your loved ones against these Delta and other variants of concern of COVID-19. And again, on the next slide, I just want to highlight how important this is for our community. As we all know, the Filipino community has been hit very hard by COVID-19. Despite making up only 1 in 25 nurses in the United States, 1 in 4 US nurse deaths from COVID-19 have been of Filipino Americans. And just on the next slide, we highlight the fact that data disaggregation is one of the main tools we have to really dig out health disparities within communities of color. Specifically compared to other nurses of color, despite being a small proportion of nurses in the US, this ongoing study by National Nurses United has really highlighted the need for our communities to be vaccinated and to be able to reach out. And tying into that on the next slide, We are helping lead, both Sheena, Shen, Samantha, many others on this call, and myself are leading a vaccine survey to learn more about the Filipino community, as well as barriers to getting vaccines. So please feel free to get in contact with us as well in order to help us learn more about our community. And so in sum, on the next slide, we just want to say, we're turning back to the Gonzaga family. After hearing all this amazing information in the webinar today, Marites was able to get vaccinated through her workplace in December as a frontline health worker, while the middle school teacher was relieved when he received his vaccine in February as part of the effort to vaccinate educators. Bea and Paolo, the mga bata, they were unaware at their young ages how relieved their family were to finally have a safe and effective way to protect everyone until the vaccines are available for children under 12. And the whole Pamilya was very excited to be together again today to help Lolo celebrate his 68th birthday, a milestone that sadly many people in our community may not reach in the coming years without action and care from each of every one of us working together. And again, on the next slide, just in summary, COVID-19 vaccines are safe, effective, and can protect your family against serious coronavirus infections, including the Delta variants. You can search vaccines.gov, text your zip code to 438-829 to book your COVID vaccine appointment today, and also seeking out trustworthy sources for COVID-19 information from the CDC, your local health department, or FilAm community resources like tayohealth.com. And with that next slide, these are all smiling faces of millions of kababayan who have been vaccinated, including Dr. Moya, I'm sure Dr. Abia, Dr. Suman, everyone who's going to be on our panel today. And with that, maraming salamat po, and we welcome your questions.
Thank you so much, Sheena, Shen, and Melissa, Dr. Palma, for this wonderful talk, webinar. So many lessons learned, and we have a lot of folks here who are ready to ask questions. So I don't know if we want to have Samantha, if you want to moderate the questions.
Yeah, so thank you again, Sheena, Shen, Dr. Palma, for such a wonderful presentation. I actually wanted to start off this Q&A by asking Dr. Abiad and Dr. Supan if you guys can kind of give us your overall reactions to the talk and any top advice or recommendations that you can give to everyone listening. So I don't know which one of you wants to go first, but.
I can go first. This is Dr. Sufan talking. Yeah, thank you. That was very, very informative and I think very easy to understand, which I think is really key in, getting the information out there effectively. I think that Sheena, her slides in particular, there were some points in there that I use myself when I counsel on vaccination. The seatbelt analogy is something that I use very often and seems to be pretty effective. So definitely agree with everything that were mentioned there. And yeah, I agree with everything that was presented here. So great job, guys.
Yeah, thanks for that presentation. As really summarized everything from the mechanisms of the vaccines to how we're doing with Delta. I guess maybe the only thing I would add, sort of, that I've had I guess more success with convincing sort of hesitant patients recently is really. Well, Delta, really. I mean, so two of the big, I mean, of course, there are a lot of sort of completely out there reasons not to get vaccinated, and those are a little more difficult. But two of the big ones for many hesitant ones that I've found are well, I'll just keep doing. I have this been going on for almost 2 years now. I've still not gotten it. I'll just keep doing that. And my answer to that is Delta. This is not the same old pandemic we were in last year. And basically the way it's been put is basically with Delta around, either in the coming months, maybe, either you're going to get vaccinated or Delta's going to find you. So that I've found sort of has resonated with a lot of people who feel that, well, it's just the same old. I've been doing well so far. But yeah, thanks for, again, the bottom line is again, our way out of this is vaccination, vaccination, vaccination. I mean, it's important, of course, that we go back to masking and social distancing and things that we thought we'd put in the back in the rear view mirror. But yeah, bottom line is, as all our speakers today have emphasized, this is really vaccination and getting it out there to our community and to all those who are still not taking advantage of this important tool for ending the pandemic.
Thank you both so much for your insight on that. We can start with some questions if that's okay. One question that we got from the group was, for circumstances where there's no second dose of Sinovac available, can they receive another vaccine other than Sinovac? And then going off of that, if people have received 2 doses of the Sinovac, do they have to receive 2 doses? Oh, if they haven't received the second dose, can they get a different vaccine? And if they get a different vaccine, do they have to complete the Moderna or Pfizer vaccine?
You want to take that? I guess maybe I'll take a stab at it. Again, this is a very common question, especially from our friends and relatives back home, where Sinovac's one of the sort of most frequently used vaccines, but sort of the other, including the mRNA vaccines, are becoming available. There really isn't a whole lot of data for this sort of heterologous vaccination where you mix and match. Really, there is some data from Europe for having the first dose of AstraZeneca Oxford and the second dose of Pfizer, and so in Europe and I believe in Italy, that sort of they authorize that particular combination. But there really isn't any data yet for other combinations. There are sort of studies underway, including Sinovac, even Philippine General Hospital in Manila. It has a study underway for like Sinovac followed by an mRNA vaccine, but data for those are not available yet. Generally, and at least in the Philippines, I mean, certainly, again, this supply of Sinovac seems to be very plentiful. So I've not heard it being an issue where people haven't been able to get their second dose of Sinovac. And in fact, really they've sort of been holding back the second when you get your first dose, they sort of reserve the second dose. So I've not actually heard of anyone back home sort of having difficulty getting their second dose of Sinovac. Now, in terms of someone who's had the complete series of Sinovac and wanting to get the imported vaccine or the mRNA vaccine, theoretically, certainly there are advantages, but again, there's no data. And as we were discussing earlier, I mean, and right now, I mean, even the Sinovac, again, sort of the overall protection against sort of even asymptomatic infection is a little lower than the mRNA vaccines, but still against the most important ones, which is really severe disease, hospitalization and death, it's still very highly effective. So people who've received Sinovac should really not feel that they've gotten inferior care or that they're at much higher risk. And again, we were discussing earlier, there are the sort of moral, sort of the ethical issues of using up a third dose when you've already been technically fully vaccinated, when so many, especially in the Philippines, where you know, what were we, like, I think 7-8% of the population has been vaccinated. So taking up a third dose when so many of our countrymen there have not been vaccinated really has issues.
Thank you. The next question that we have is, if I am thinking of getting pregnant one day, should I get the vaccine? Or if I am pregnant, when is the best time to get the vaccine? Is it early on during the pregnancy or later?
I think I can address at least part of that. I don't really take care of many pregnant women as a pediatrician, but I do take care of a lot of babies. So the American College of Obstetricians and Gynecologists released a statement very early on after the vaccines were released, stating that the vaccines were definitely safe in pregnant and breastfeeding women, and actually it's beneficial to get the vaccine while you're pregnant, or if you've just given birth, like while you're breastfeeding, because it does confer some immunity to your baby. Pregnant women are also at higher risk for complications from COVID, from blood clots from COVID, for getting very severely ill from COVID, and even dying of COVID. So definitely decreases your chance as a pregnant woman of dying of COVID as well. So definitely very safe, has not been shown to be correlated to any increases in miscarriages, any increases in congenital defects in babies, and COVID you can definitely pass from mother to baby in the delivery room. So that's another thing you can do to prevent that from happening as well. And while that's still rare, definitely can still happen, and especially in light of increasing Delta cases, which are more contagious. Anticipate, women who are not vaccinated can definitely, pass that on to their children as well. So bottom line, very safe, very effective in pregnant women and lactating/breastfeeding women, and very much encouraged to do so.
I agree. And the only thing I had to add to that is, no issues about getting it in the first trimester. So the answer to, if you're pregnant, just get it as soon as you can. If you're planning to become pregnant, just get it as soon as you can anyway. Basically, for everyone, it's safe, and the sooner you get it, regardless of your plans of pregnancy down the road, the better.
Thank you. The next question we have are, what are the most effective ways to influence those who are not vaccinated to get vaccinated in the Filipino community? And what are some strategies that can be used that have worked best to reach our community?
So I think that one thing that really people have to wrestle with when it comes to this idea of vaccine hesitancy is that a lot of times there's personal reasons why people don't get vaccinated, but there's also structural reasons why people can't get vaccinated. So if you are a person who is, an essential worker who does not get paid sick leave off, who does not have childcare, who does not have transportation and access to vaccinations, that is a barrier that is preventing many low-income members of our community from getting vaccinated in the first place. For those people who do have, these lingering questions about hesitancy, a lot of times it's because people aren't hearing a message, from a messenger that they trust or in a way that they understand. So for example, like we had said before previously, in that really, not always about telling facts, but also listening to what people are saying and why they feel scared. As with COVID, for all of us here in the healthcare community, it probably took us seeing COVID intubated prone patients in the ICU day after day after day to really drill into our heads how serious this disease is. But for a vast majority of people, that's not their experience. For a vast majority of people, it might be a far off distant relative. It might be some sensationalized things they see on the news. And this is also why the disinformation within social media networks is also very concerning, because the people who they trust, their family members, their close friends, the people who are in their Viber groups, their WhatsApp groups, their Facebook groups, these are the folks who might not be able to access the most trustworthy and relevant information. So I think some of the best strategies, including listening for understanding about the people you care about, reiterating that vaccination is something that we do for each other and something that we do to keep us from getting severe COVID-19 and being at risk from death from COVID-19. And also that, sharing a lot of the resources that we had that is more culturally tailored, more linguistically accessible, and really targeted towards the concerns that our community has.
I think Isa brings up a great point. That's why I screenshotted all of the slides that they had. So we'll be putting that up on all of our social media accounts as well. But having culturally tailored outreach is just so important, especially for the Filipino community.
Thank you, guys. Going off of that, another question is, when people have this discussion about the benefits of being vaccinated to their unvaccinated loved ones, how do you think that that discussion can be approached to not seem disrespectful? And how do you think it can be responded to, like bahala na, or things like hiya and shame and all of that?
So I think that, you know, one thing that I know Dr. Moya's research touches on this a little bit is the intersection of how Filipino community members interact with each other and how does this affect their health. So we know that within our community, you know, there's oftentimes this idea of hiya, that things that are bad are shameful, that things, serious things that happen to people, you know, if you want to be able to keep it within a small group of folks because you don't want to burden others with something bad that's happening, or you don't want other people to know that, you know, maybe you caught COVID and you might need support at this time. And so currently there really aren't a lot of any studies that I've heard of that kind of look into this connection, other than the one that we're trying to design at this moment. However, for those of us who, you know, within our own family units, you know, say you're the ate and you are able to influence your younger cousins and your younger siblings because you are someone they look up to. But maybe it's harder for you to talk to your lola or to talk to a tita who might think it's disrespectful for you to kind of present things in this way. And so I always try to look at, well, who do they look up to, right? For the tita who goes to church religiously every Sunday. You know, the Philippine Conference of Catholic Bishops from very early on had stated that COVID vaccinations is a way of protecting the poor and a way of expressing our care for one another. Very early on from, you know, the pandemic, there have been other groups of, you know, 96% of physicians in the United States, including many members of FilAm, and NCAPIP and other Asian American physician groups have received a COVID-19 vaccine. So to say that, you know, here are other members of the community who are well respected and who are seen as positions of authority as well. These are people who we trust, and these are also people that we know.
Thank you. So I know we're running out of time. We have 3 more questions left, if that's okay with everyone if we ask those. Okay, so the next question that we have, should we be wearing masks indoors if we're all vaccinated and we're living with elderly or immunocompromised family members who are also vaccinated?
And the question, I presume, is when you're at home then with these family members?
Yes.
Yeah, and in general, again, the guidance has been if you're vaccinated, if everyone in the household is vaccinated, then obviously masks are not necessary. But again, the Delta sort of is throwing a wrench into all of these all of this guidance, and we're sort of still sorting out right now what still holds and what doesn't. From everything from how long do we do quarantine, how long do we isolate, all of this is sort of a little up in the air with Delta right now. And certainly if you have high risk or immunocompromised family members at home, it will sort of depend on the risk of the people who are going outside of the home. So certainly, you know, if there are family members who work in a grocery maybe, or in a sort of other settings where they might be indoors with a lot of other people who aren't necessarily wearing masks, then they might, even if they are vaccinated, they might be bringing the Delta virus home, and then in which case the extra precautions might be warranted. So bottom line is we're still figuring out, but I think we need to be extra careful at this point, and always just play safe if there's any risk that we're bringing home, particularly the Delta virus, to sick or high risk relatives at home.
Thank you, Dr. Abiad. This question is actually for Dr. Supan. As a pediatrician, which pediatric populations can get vaccinated now? Can they get any of the vaccines? And will this change in the future?
Great question. So as of right now, Pfizer is the only one that is available for children under the age of 18. So we can vaccinate 12 and up with Pfizer, and that's what we've been doing at the hospital that I work at. Moderna is still 18 and over, Johnson & Johnson is still 18 and over, but from just the reports and studies that I've been reading, and I've been looking forward to this every day, it looks like Pfizer is getting close to, I don't know if they've already released the studies that they've done on the kids as young as 5. I was reading that as early as September, they might have, the studies available for the FDA to review. Now, how long that'll take to review, that will be up to the FDA, but I anticipate before the end of this year, we should hopefully have a vaccine available for kids as young as 5. And then there are already kids even as young as 6 months who have been recruited into the studies, but that will of course come a little bit later. So we're waiting pretty much, but yeah, I'm at this point, 12 and up, Pfizer is the only one.
Thank you everybody for attending this webinar on COVID-19 vaccines para sa ating mga pamilya. We could not have done this webinar without the support of the National Council of Asian Pacific Islander Physicians through funding by the Walmart Foundation. We also would like to thank Tayo Help from FilPRO, CFAM members, the Council of Young Filipino Americans in Medicine, NCAPIP, as I said before, and the We Can Do This campaign. So thank you everyone for your support.